Now, people are now rushing to get flu jabs. While the flu vaccine does not prevent COVID-19, it's been said that it could result in fewer COVID-19 deaths. For more on this, I'm joined by senior epidemiologist from the National Institute for Communicable Diseases, Sibongile Walaza. Sibongile, thanks for your time. We appreciate it. So I actually tried to go and get a flu vaccine today, but there was too long of a line. So we're seeing lots of people go to pharmacies and doctors for this. How effective is it when it comes to the flu? And then we'll separate it when it comes to COVID-19.
Oh, thank you, and thanks for having me. So an influenza vaccine is meant to prevent influenza. So in the years when there's a good match between what's in the vaccine and the circulating strains, so the effectiveness can be between 40 and 60%, and could be even higher than that. But as you mentioned, I mean, it really is meant for the prevention of influenza, not necessarily to prevent COVID-19. However, it's important for people to do go and get the influenza vaccine, because then if we do prevent influenza-associated illnesses, then we'll prevent so many people getting to health care facilities, and also so many people dying of influenza.
Yeah, and obviously it will also protect your immune system, so that even if you do get COVID-19, you have a healthier immune system, right?
Potentially, yes. But I mean, the main reason why we're giving it is to prevent the influenza, and therefore prevent the influenza-associated illnesses.
Yeah. There have been two studies that we've been looking at. One, a U.S. report found that people who were vaccinated with the flu shot last year were more significantly likely to return negative results when testing for COVID-19. Has the NICD looked into that at all?
Nope, we've not done any work on testing the efficacy or effectiveness of influenza vaccine against the COVID-19. We haven't.
Yeah, okay. So also let's talk then about the effectiveness of flu shots. I mean, many people will want to go and get it to prevent getting the flu, but it doesn't always protect people, does it?
No, it doesn't always do it. But again, remember, then every year we've got circulating strains, right? And it also depends on what is on the strains that are in the vaccine. However, even if it doesn't cover all the strains, even if the vaccine that we have doesn't cover all the strains, it does then prevent some of the strains. That's number one. And also, it's been shown that for people who are vaccinated with influenza, even if they do get the influenza, get infected with influenza, if they've received the vaccine, then the illness is not as severe as a person who was not vaccinated. So even though, I mean, it's not 100% effective, but it does prevent a lot of people from being sick, and preventing a lot of people from accessing care, and therefore burdening the health system. And again, for those who are at increased risk of severe illness, for example, people with underlying conditions, then it does prevent them from having severe outcomes like death or hospitalization.
Yeah, and the key word is prevent, right? You have to have this flu shot before you actually get the flu, correct?
Correct, yes. It takes about 2 weeks for your immune system to develop antibodies to prevent you against getting sick from the influenza. So we really do encourage people to get the influenza vaccine before the influenza season, so that people are adequately protected.
All right, thank you so much for your time. We appreciate it. Sibongile Walaza from the NICD.